Were you skeptical before starting the program?
Oh yeah, I walked out of here thinking, what did I just sign up for?
Mm-hmm.
But after probably 2 months, I was completely off the gabapentin.
Excellent. How much would you say you've improved 0 to 100% overall?
I would say about 70.
Well, a lot of that has greatly improved to the point I would figure somewhere in the 80 to 85% range. I've noticed considerably that I'm sleeping better at night, that burning, tingling, throbbing pains have pretty much subsided.
Excellent.
Very infrequently that I'm getting these type of things, and I followed the treatment recommendations as directed.
So how much do you feel like you've improved overall since starting?
Probably about 70%.
Excellent. Were you skeptical before you came in?
Very. Very.
Okay. Well, I'm Dr. Adam Schatzko, DC. I'm also board certified in neuropathy from the American College of Physical Medicine. I have 2 neuropathy clinics in the Twin Cities, and I've personally consulted with over 1,000 neuropathy patients in my career. So I come from a point of expertise and a lot of experience and authority. And you can even look on our websites. We have dozens and dozens and dozens of patient testimonials from patients who have gotten really good improvements from their neuropathy, even when they've already tried traditional medical care. And when you have neuropathy in the feet, there really are no surgeries for it besides amputations when they cut toes off. And then also, if you're going to take drugs, there's really 2 primary drugs that they're going to give you. It's usually gabapentin or Lyrica. And most of those drugs, and people don't know, they're actually anti-seizure drugs. So they're actually not doing anything to regenerate the nerves in your feet. And there's really no research out there that shows that when you take those drugs, it's actually going to fix or regenerate the problem in your feet. In most of those cases, those patients are going to get worse. So it doesn't do anything to stop the progression of neuropathy getting worse, because neuropathy is a degenerative disease, which means it gets worse the longer you let it sit there. So in our clinic, what we do is we use a bunch of different therapies such as laser therapy, light, electrical stimulation, PEMF machines, vibration therapy. And what these are really trying to do is stimulate your body to respond and heal. And what they found is that certain therapies can actually stimulate more blood vessels, stimulate more blood flow. They can also help aid in cell regeneration. And this is all there's a lot of research. There's also things that our therapies can do and have been shown in research is they can actually improve the sensitivity. And then also ours can stimulate growth factors, and it's really stimulating your body to try to regenerate or fix the underlying damage as much as possible. Research has shown too that it has the potential to stop or really slow down the progression of your neuropathy as it moves forward. So in our clinic, what we're trying to do with this program is actually help patients try to address or fix as much of the root cause as possible, and that leads to more permanent long-term effects so that patients don't have to worry as much about getting stuck with a cane or a walker or really having their life severely limited, because their quality of life can really take a hit if you really lose the ability to walk and be mobile with your feet. Our neuropathy program is a 4-month program, and our 4-month program consists of 9 in-clinic treatments. They take about 30 minutes. Patients will complete those treatments usually once a week or twice a week. So depending on how often you come, you will complete the in-clinic treatments usually in 4 to 8 weeks. When you come in, you're going to sit down in this nice chair. Our staff will take care of you, and you'll have this view looking out the window. Pretty much you have to relax for 30 minutes. The clinic will do the rest of the work. When you're in the office for the in-clinic treatments, the point of it is to stimulate the area with some of our higher powered equipment, but also teach you what you're going to do from home. And our home program is done every single day. And the reason we do that is because we need patients to try to constantly stimulate your feet or hands to heal every single day. And that's what those therapies do. Everything can be done with you sitting down, watching TV, reading a book. There really is very little time of you having to actively do treatment. You just have to set it up and use it. And for example, on the right, the light therapy, this is how easy it is for you to put this on. As you can see, as long as you can get your foot to, or as long as you can reach down your foot and strap the equipment on, you'll be able to do the care at home.
Light therapy is the #1 non-invasive treatment now preferred by therapists for all things having to do with skin and soft tissue. Light therapy devices are FDA cleared to increase circulation and reduce pain. To learn more, let's take a closer look.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Tissues that need to heal require oxygen. The key to accomplishing this? Better blood flow. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following. Improved sensation, which offers better gait and balance when walking. Reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities. And finally, increased circulation, which offers the body shorter healing times.
The second piece of equipment you use at home is the electric therapy, and it can be applied very easily also. Once your 4 months of care are done, and during that time period, our staff will be calling you every 3 to 4 weeks on the phone to get updates on your care. If at any time you have any questions or concerns, you can always call the office. And if you ever need to come in to sit down with one of our doctors, we can schedule that too. But at the end of the 4 months of care, you're going to come in for an end of care appointment. At that time, we're going to discuss your symptoms, how much improvement you've had, and how much better your testing is. Perfect. So how much do you feel like you've improved overall since starting care?
I would guess over 90%, well over 90%.
Excellent.
I think it's wonderful coming here. And I really like the fact that we can live out of town and still feel welcome here when I do have an appointment.
Yeah. We like people from all over. Any other doctors you tried before to try to get help?
All they did was put me on gabapentin, and that didn't work.
So it didn't do anything for you?
No. And then I heard your advertisement on TV. No,
So since going through our program, do you have any numbness in your feet?
No.
Do you get any of the pins and needles pain in your feet?
No.
So it's totally resolved?
Mm-hmm.
So from the neuropathy, how much do you feel like you improved overall?
I would say 100%. No.
Anything else?
No, thank you.
You're welcome. So in our clinic, when you come to us, you're going to know you're going to get expertise. Not saying that we can accept every patient or we're going to fix every patient, but we'll do the best we can to try to assess you, see where you're at, give you an honest opinion of if we could help you and what a program would look like for you. So if you'd like to make an appointment, call our office and get set up with a consultation to come and speak with me or one of our doctors. Or if you'd like, you can keep reading on this page. There's more information down below. I hope you get better. Take care.